Well, let's talk about the different types of inflammation. Do you want to give us a little bit of coaching on what's out there?
Well, I mean, I talk with patients about this every day. We have acute and chronic inflammation. Acute, I fell this morning, I sprained my wrist, or I cut my hand open chopping up a tomato. And that's acute inflammation. That's where those white blood cells, come to the area. That's where the redness and the swelling and all of that. That's acute inflammation. It immediate kind of thing. And that's okay. That's for a purpose, and it starts to heal and things get back to normal, hopefully. Then we have chronic. That's the long-term simmering decades of dysfunction going on in there, from bad food and stress and maybe a bad job and just lots of things going on, bad relationships. That's the chronic burning inflammation where you never get a chance to resolve that inflammatory response. You just keep this slow burning inflammatory response through the decades. That's your chronic inflammation that eventually turns on all kinds of diseases like we just talked. And we know that inflammation, anything that ends in itis, right? Arthritis, gastritis, colitis, sinusitis, thyroiditis, vasculitis, all the itises, that's an itis means inflammation. So that has an underlying inflammatory response. And that's what we work on, is really all of us, anyone in functional medicine, decreasing that chronic inflammatory response in patients. There's multiple ways to do it, but we start with diet. For me, that's what works best for my patients.